everybody. Kaylee Garrett Zimmerman here. I am a physical therapist. I wanted to chat a little bit today about the importance of breathing properly before you go into any type of exercise for the pelvic floor and how it kind of relays into each other. If you're not breathing properly, then you're not going to be able to do the types of exercises that you want to do with the appropriate control, stabilization, coordination, and function of that pelvic floor that you need, especially for those of us that have had pelvic floor impairments. So we go straight into, a lot of times we talk about things like, oh my goodness, I've had prolapse, I've had like 6 kids, whatever it might be, and I've got all these things going on, but that's normal, and I'm having pain with sex and all these other things. But in all essence, a lot of times we just need to kind of figure out how to tune into ourselves, to figure out what's going on, to know how we feel, to know what's actually happening in our pelvic floor. So I really wanted to be specific today about a breathing technique. It's not even a technique really, but it's just to remind you of the importance of breathing and starting there. So even if there's not a whole lot that you can do to take away the pain or to take away the symptoms that you're having, you can start somewhere like breathing. You can start there. So your diaphragm sits right here under your breasts pretty much, and it's a big muscle, and it's really responsible for breathing, and it should be the muscle that contracts with breathing. But a lot of times we don't use it appropriately because we cheat and we use muscles up here, and that's why you see chest breathers and people that breathe into their chest. So what I want you to do as far as an exercise to kind of start getting used to this is you're going to sit with one hand on your stomach, one hand on your chest. You're going to take a deep breath in through the nose and fill your belly with air. And then breathe out through your mouth. In through your nose, out through your mouth. And pay attention that you're not breathing into your chest, because that's kind of bypassing what I'm trying to get you to do. Of course, your chest is going to move a little bit, but it should be more so in the stomach. And I want you to be able to breathe into the stomach. When you do take a deep breath into the stomach, you're going to feel a little more of a relaxation and a lengthening happening in your pelvic floor. When you breathe out, it's going to be about twice as long as when you breathe in. So you're going to have a longer time to breathe out, to get all of that oxygen out of or all of that air out of your lungs, so that you can get rid of that and start that again, okay? So that's step one, and this is a good technique to utilize if you're having pain, if you're just trying to start somewhere, if you're trying to do something, or if you're just getting started and finding who you are and kind of like getting into meditation, getting into figuring out how to take that next step or where to go. So it's very important. But I just wanted to tell you guys that little tip. I will be having more coming soon. All right, guys, thank you.